to serve healthcare workers, patients, and their caregivers. Today we have the renowned gastroenterologist from Mumbai, Dr. Rajdeep More. He needs no introduction. However, I would fail my duty if I don't mention that. Dr. Rajdeep is a leading gastro in Mumbai, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with GastroCure Endoscopy Center and Liver Care Clinic, Thane, Mumbai, as a senior consultant. Sir, we salute your dedication to spreading awareness related to liver health. So now I invite Dr. Rajdeep More to enlighten us on the topic, the current management of NAFL and NERS. Sir, over to you.
Uh, Thank you for the introduction. Good evening, everyone. So today we are going to talk about a very important and a pertinent topic, which is gaining widespread awareness. And today we'll be adding to those efforts of spreading awareness regarding this entity called as fatty liver, or the medical terminology that is non-alcoholic fatty liver disease, or NAFLD. So the liver, as you know, is the second largest organ of the human body. It's located in the upper right hand portion of the abdominal cavity, near the stomach, on top of it, and the intestines. It is pinkish brown in color, soft consistency, and is highly vascular. It performs a number of functions, some of the most important ones being destroying the old RBCs to process the nutrients. It also helps in production of bile, regulating blood composition, manufacturing proteins and cholesterol. Also controls about 500 metabolic processes. It breaks down alcohol and medications, and also detoxifies the blood. So what is non-alcoholic fatty liver disease? It is a condition which makes up, it is a condition in which fat makes up about more than 5% of the weight of the liver. Usually a normal liver will have less than 5% of body fat. It is not caused by alcohol use, so hence the terminology NAFLD, or non-alcoholic fatty liver disease. Left untreated, it can progress to a condition called as NASH, or non-alcoholic steatohepatitis, which basically means inflammation of the liver. So most important risk factor here is being overweight or obese. So having type 2 diabetes or high cholesterol, all these are associated with an increased risk of non-alcoholic fatty liver disease. So here you can see 1 out of 4 people have NAFLD regardless of their weight. More than 6 diabetics and 9 severely obese patients out of 10 have non-alcoholic fatty liver disease. It has been proven in studies that the male gender has a high risk factor for progression to NASH and eventually fibrosis or scarring of the liver with pre-existing NAFLD. So this is how non-alcoholic fatty liver disease progresses. It's a healthy liver which progresses to fatty liver, liver fibrosis, and cirrhosis. So you can see the double arrow till about liver fibrosis, which means that if adequate interventions are done in the form of diet, lifestyle, and medications, there can be reversal of liver fibrosis back to fatty liver and eventually a healthy liver. However, once the cirrhotic stage is reached, the scar tissue destroys liver cells and the liver is unable to work properly. So what is the difference between NAFL and NASH? So NAFL and NASH is a fat accumulation in the liver, also known as steatosis. Steatosis will lead to inflammation of the hepatic cells and known as non-alcoholic steatohepatitis. And eventually there is scarring of the liver. So you see the two images, NAFL and NASH. So NAFL is the early stage where there's only the fat accumulation in the liver. Eventually, this fat causes a lot of scarring and inflammation, leading to a condition called as NASH. So what are the causes? So most common and the most obvious one is obesity and metabolic syndrome, but there are also other causes which are hidden and which need to be evaluated in detail, such as genetic background, food quality, the quality of food that you take, the ingredients that are eaten, as well as a sedentary lifestyle and physical inactivity. Another common cause of non alcoholic fatty liver disease, which is often ignored, is being exposed to certain medicines which can cause steatohepatitis. So, being overweight or obese causes fat accumulation. Obesity increases the amount of fat to constitute about more than 5%, and this leads to NASH and scarring of the liver. So, what is the association between NAFLD and diabetes? So, there is a bidirectional association where patients with diabetes eventually develop NAFLD, as well as conversely, patients with NAFLD eventually end up with diabetes. Threefold increased risk of death due to cirrhosis, and increased risk of NASH, and high prevalence of diabetes, and 2 to 4-fold increased risk of developing diabetes in NAFLD patients. So, what are the symptoms with which a patient will present, or what are the symptoms that you need to take into account? So, the most important thing is that many of the patients who are in the NAFLD or the early stage will not have any symptoms, and it is usually diagnosed on routine evaluations such as a sonography of the liver. There can be mild non-specific symptoms such as mild fatigue, discomfort, or abdominal pain. There can be symptoms of advanced NASH such as increased fatigue, nausea, buildup of fluid in the abdomen, confusion, decreased loss appetite, bleeding easily, regularly. So these are all the symptoms of advanced liver disease or cirrhosis. But the early NAFLD symptoms, they may not be any symptoms or very, very mild symptoms, and hence it is important to get evaluated. So how do you evaluate for NAFLD or fatty liver? So it is a silent killer because progression of disease is very gradual. It often involves the following: blood test, ultrasound or a fibroscan, a liver biopsy, X-ray, CT, and an MRI. So these are all the modalities. We'll discuss about them. So the blood tests, the most common blood test you must be knowing is uh, the liver function test or liver enzymes, which are known as SGPT or SGOT, also known as ALT, AST. So persistently elevated ALT can be associated with disease progression. Normal ALT patients can develop progressive disease. Up to 80% of NAFLD patients can have a normal ALT. At present, there is no designated cutoff, but persistently elevated ALT levels usually brings the patient to the doctor, and then on evaluation, it is found to have NAFLD. So liver function tests are very important. There are some advanced scoring methods that should be known, such as age, AST, ALT, platelet count. Also, there are various scores such as FIB4, NAFLD fibrosis score, which helps us, which are basically online tools where you can calculate the scores and you can generate values and understand, based on the score, you can understand the risk of developing NAFLD or NASH. Moving on to the non-invasive diagnosis, yes, the frontline test is an ultrasound of the liver. So frequently diagnosed on ultrasound is fatty liver. It is easily available, economic. Reason for the most accidental diagnosis of NAFLD. The downside or the flip side being that it only detects NAFLD if fat is more than 25%. So a large chunk of patients can be missed if you rely only on ultrasound. It cannot differentiate between fat and fibrosis. Nowadays, we have an addition to the armamentarium of non-invasive diagnosis, that is transient elastography in the form of fibroscan. It helps to diagnose NAFLD when the fat is only more than 10%. It helps to differentiate between fibrosis and fat content and easily to operate. It is far easier to operate as compared to a sonography machine. Again, one of the flip side being that misinterpretation is common in obese patients. So there are two different values where we get in transient elastography or fibroscan. That is the LSM, liver stiffness measure, controlled attenuation parameter or CAP. Now the advanced test being what is called as MRI PDFF, that is proton density fat fraction. Not widely available, still pretty costly. Not everybody can afford to take this as a frontline test. However, it is a gold standard to detect fat content. It can measure fat content as low as just about more than 1%. Uh, its most common use in today's time is for liver donor patients. And with time, we expect that MRI PDFF is done most commonly as a diagnostic tool as well in due course of time. Now, the old time tested invasive diagnostic test is the liver biopsy, where it is still the gold standard. It is the only method to diagnose NASH. It rules out the other liver diseases. Yes, it can be painful, individual dependent. Uh, Early stage, if the right tissue is not biopsied, it can lead to misdiagnosis. So this is how NAFLD progresses. Most of the patients remain in the fatty liver stage, about 75%. However, if there's repeated inflammation, it can progress to steatohepatitis or swelling, eventually to NASH cirrhosis. About 7% over 6.5 develop HCC, which is a liver cancer, and about 90 to 45 over 7 to 10 years develop decompensation, or what we call as liver cirrhosis with portal hypertension. So, important point to take home is that there's an increased risk of death compared with general population, be it cardiovascular, cancer related, or liver related. So, fibrosis progression is associated with diabetes, severe insulin resistance, weight gain, and a rising ALT/AST. So, the take home message is act before it's too late. So, progression of NASH can also increase the risk of heart related diseases. It is important to understand that it is a more serious form of NAFLD in which you may have scarring of the liver. And remember, severe NASH is not reversible. Moving on to treatment, yes, diet, exercise, and lifestyle modifications still form the mainstay of treatment. There are some new medications available, but the focus should be in the early stages on diet, exercise, and lifestyle. It's important to visit your doctor if you have fatty liver. Speak to your doctors, understand the cause of fatty liver and non-alcoholic steatohepatitis, and also to understand about the treatment options. Yes, controlling the weight. Since most of the NASH patients are obese, a combination of a low calorie diet and moderate intensity diet has provided best likelihood of sustained weight loss. At least 5% body weight loss helps to improve steatosis, and about 10% improves majority of the histopathological features. So this is the pyramid where there at the bottom is the steatosis, which progresses to inflammation. Uh, there can be resolution of NASH if the weight loss is about 7%. Weight loss of more than 3% can reverse steatosis. Weight loss of more than 5% can even replace inflammation, and NASH resolution can happen about if the weight loss is more than 7% of the existing body weight. And as you can see, if you lose about 10% of your body weight, there can be some reversal in fibrosis as well. Yes, there are many, a large number of diets available, but it's important to understand that it is important to have moderate portions of poultry, eggs, cheese, yogurt. There should be a balanced diet consisting of vegetables, fruits, whole wheat grains, olive oils, beans, nuts, legumes. So these form the mainstay. The things that need to be avoided are red meat and sweets. Seafood and fish can be taken twice each week. Aerobic and resistance, both exercises are essential, not just either of them. Aerobic exercise reduce fat, maintain healthy weight, improve conditioning. Resistance exercises reduce liver inflammation, improve glucose absorption, insulin sensitivity, improve metabolic parameters. So enough vitamins and minerals, regular medical checkups, small frequent meals, decrease sugar intake, enough sleep, exercise routine. All these factors are essential for a comprehensive management of NAFLD or NASH. Pharmacological molecules are pioglitazone, saroglitazar, and vitamin E. These are the ones which have been time tested, recommended by the Indian National Association for Study of the Liver. Uh, so these are some of the tips to prevent a fatty liver disease. Saturated fats and trans fats should be reduced. Eat a balanced diet. limit consumption of refined carbohydrates, limit or avoid alcohol, exercise regularly, quit smoking, maintain a healthy weight, take medications as prescribed. So I hope this has helped you understand more about NASH, and moving forward, I hope there's more awareness created and among the general public regarding non-alcoholic fatty liver disease and non-alcoholic steatohepatitis. Thank you.
Thank you, sir, for this wonderful talk. This has enlightened us. Now we will take a question from our audience with your permission. Sir, when to consult the specialist for the NASH and NAFLD?
Yes, so that's a very good question. So as I discussed that NAFLD or NASH is a silent killer. Many a times you do not have symptoms. Hence, a regular checkup, a regular ultrasound, especially if you have any risk factors such as obesity or family history of diabetes, or you yourself have diabetes, you're more likely to have non-alcoholic fatty liver disease. It gets a screening ultrasound and the liver function tests. That is the first step. If it shows fatty liver or increased liver functions, you have to visit and consult a doctor, a liver specialist, to understand more about the treatment. Yeah.
There is one question is asked by the Mr. Jayant is that sir, NASH is a age specific.
Yes, so there are some reports that it is there in the younger population, but predominantly it is in the middle ages where type 2 diabetes mellitus, lifestyle disorders, obesity take up. There is also a concept of lean NASH where there is no obesity but still patient develops fatty liver. So genetic causes are responsible for that. So in patients in whom the cause of NASH or NAFLD is genetic, it can present in the early age, in the youth, in the 20s, or even earlier, and hence a routine screening is very essential.
Okay, sir. So, sir, on behalf of NASH 24 by 7, I thank Dr. Rajdeep More for his lively and informative talk. As you have been emphasizing the awareness for the liver health and disease, it is equally important for people affected by fatty liver to regularly visit doctors and continue medication. With careful observation and precaution, it is possible to obtain control of the disease. I would also like to thank our audience for their active participation and the passion in making this event successful. Stay connected with Nest 24 by 7 on Facebook and take care of yourself and your family members. Thank you. Thank you, sir.
Thank you.